We wrote this book because clinicians in our field are dealing with patients hour after hour, day after day, and it's not easy. And so it's helpful, we hope, to have experienced clinicians who've been in the trenches for a long time, taking the most up-to-date information combined with our clinical experience and putting it into an easy-to-use reference that's right at your fingertips. If you're a little like me, when you're wondering about a medication, you don't really pull a book off the shelf anymore. You just Google it and see if you can get to the right web thing. Actually, the fact sheets in this book have pretty much everything you want and need. It's got the usual indications, the FDA approved, or some of the additional ones that we talk about a lot of the time, side effects, dosing, and a bottom line.
It's a really quick and dirty resource, especially when you're in the clinic and you're maybe seeing patients in the community back to back, and you have a lot of things to do, you have a lot of things on your mind, and you're really strapped for time, but it has a lot of really, really useful and clinically relevant information packed in to one page.
Everything's on one page. Everything you need to know to make a clinical decision. The dosing, the side effects, the drug interactions. What's great is when patients or family members ask me questions, I can share the fact sheets with them because really the answers to the questions that they frequently have are right there on the fact sheet as well.
It's a really easy way to compare different medications and different medication options that you're kind of grappling with when you're thinking about addressing specific target symptoms or specific diagnoses. One example of that would be for ADHD. There's a lot of kids that sometimes have trouble swallowing pills, or they have some sensory things and preferences, and it's a really quick way to be able to see like, oh, this one comes in oral solution, or this one's dissolvable, this one is sprinkles, this one's chewable, and there's a lot of new options available that it is easy to then kind of see and be able to reference and make those decisions.
This is the kind of table that really takes you where you need to go. You have pretty much everything that's on the market right now, including new stuff that apparently works overnight, goes, as long as it needs to give us all the information we need. The book also talks about how do you transition between some of these different products. You know that even though they're the same chemicals in all the methylphenidate ones or the dextroamphetamine ones, some of them don't map over directly.
The tables really give you a bird's eye view of all of the medications in a particular class. So if you forget one particular agent that maybe you don't use as often, it might help trigger and remind you to use something that might be appropriate for that particular patient. As many of you know, if you've used the original medication fact book, we have a lot of appendices in that book that our readers really tend to use quite a bit. And so we made sure to include those tables in this fact book as well. So you'll find tables on drug interactions, for example, and tables on lab monitoring for what you need to monitor for each agent and how frequently.
We included the AIMS table so that it would be really accessible for anyone who is prescribing first and second generation antipsychotics. That's often something that's, I think, easily overlooked when you're really busy, and it's hard to have at easy reach when you're meeting with someone in the moment and you're forgetting maybe to track every month initially, or every 3 months, and then every year how they're doing in terms of any concerns about the EPS side effects.
We all ought to be watching blood pressure and pulse and height and weight, and our kids, particularly the ones who are on stimulant medicines. Well, this book gives you the charts for looking at all those things, like blood pressure in boys versus girls at different ages, percentiles, and you find out if you're in the ballpark or not. And it can be a little surprising sometimes.
We know a lot of the medications we use tend to have a lot of side effects, especially GI side effects. The weight and height growth charts and the BMIs are really nice resources to be able to use in the moment when you're checking people's weights, when you're kind of seeing how far they've fallen off the growth curve, if they have appetite suppression with stimulant medications. And so that was one thing that we thought was really valuable to include in the book.
I'm kind of an informed consent nerd. I love the whole idea of using the informed consent process as a way to drive better care. So we've got an appendix on that gives you all the different elements of informed consent that I think will help guide you to better practice.